Thank you, Dr. Mamidi. So, Dr. Mamidi has stressed on the importance of our natural aptitudes. He felt like a square peg in a round hole, he said in MBBS. And we have cases, every year we have 1 or 2 students like that. For various reasons, they enter the course, chiefly for parental satisfaction. So it is very important to find your natural aptitudes. And now the question comes of, interprofessional education. There are lots of new vistas opening out for medical students. All the things, all the areas where medical science is interfacing with technology. So would anyone like to say something? Dr. Kanakadurga? Hi.
Yeah, actually I was about to bring this topic a little later in terms of a career choice for a hospital administrator or a healthcare manager. Since Madam has mentioned it, I'd like to share some very exciting future possibilities. One common thing you might be hearing everybody saying is think out of the box. See, when we did our graduation, we had very rigid paths, like either you're into medical stream or into your engineering or it's a chartered accountant, very fixed paths. 10, 20 years down the line, say even in mid-80s, 90s, there are umpteen opportunities opening up with the IT sector. You see the exciting possibilities now, which we never thought of about 15 years back, mid-90s also, 20 years back. We could never think that there'll be so many things. Engineer means mostly civil engineer, but with IT sector, you see the possibilities opening up. Now there is an overlap. Yeah, I think they can hear. Now you see the wonderful overlap. Technology is overlapping into medicine also. So you have medical informatics, you have technology invading your diagnostics. All these are wonderful possibilities. It's up to us to look for opportunities. Your basic training is one thing, your specialized training is one thing. But when you think out of the box, you create your own possibilities in terms of career options. You create. So there are a few things which are listed out as very exciting, future, what shall I say, technological innovations. You have to look at these prospects, keep updating yourself with the knowledge periodically. Now Google is a wonderful tool. There's so much of information out there. So one of the things that is coming up is 3D printing. 3D imaging we have seen, 4D, 3D imaging. Now 3D printing, what is the 3D printing in medical technology? They are actually printing liver. I don't know what exactly or how they print, I have not seen it. I still have to go further into this information. What they are using it as a diagnostic tool for researching on drug toxicity on the liver. Can you even imagine printing liver? I mean, for us printing means it's something, on paper, black and white or color. But printing a tissue and trying to look at drug toxicity, the effect of drugs on liver. Just imagine, I'm just giving you clues because the time is very short. We have many topics to discuss. The other is the human-computer interaction. You sort of have an idea right now. There's something called as a brain-computer interaction. Your visual and your brain impulses with the commands, you are able to actually translate it into some action. This is the future, technology. Brain-to-brain interaction. You have a paraplegic patient. This part of, it is also a part of robotics, I think. Brain-to-brain interaction. You're trying to sort of influence the movements of somebody or, something by transmitting impulses. I'm not going to the details of the technology. I'm just saying the possibilities. You look at the wonderful opportunities that are available out there. Brain-to-brain interaction. That is another wonderful area that's being worked on. A lot of universities are putting huge funding into this. And the possibility they are saying is a paraplegic patient who has been bed-bound or wheelchair-bound for the last 20 years, he is able to move around and have a normal life. Can you even think of that? So that is one thing. The other is robotics itself. To some extent, surgeries are performed nowadays using robotics, robotic arms. You can see which are the areas this tool is being applied. You can research it. So robotics is one area. And the other is diagnostic tools. Stethoscope is a great invention long time back. You have your knee hammer. I think you're still using all these tools. Go to about 15-20 years ahead, future. You're going to have a single tool. There is a huge prize money out there which a company has, been announced. $10 million they've announced for research and coming up with this tool, which is like you would have seen in Star Wars and all, no? Like it's like from head to toe they're lying on a table. From head to toe the tool is just passed. All the information comes on the table, whatever is inside, outside the patient. You thought this was just some crazy, imagination in the mind. It's actually happening out there. Many universities are researching on this. They're coming up with a single tool which gathers all the information of the patient. It could be an ultrasound image, an MRI image, it could be some biochemical parameters, everything with just one tool. A $10 million prize is there, and a lot of research is going on in that area also. I mentioned robotics. And then you have a patient, how future is going to be between a patient and a physician. Now here we have to take an appointment, go to the hospital, wait there endlessly, talk to the physician. The physician is already stressed. They have to see about, Dr. Manisha was just now saying 200 patients, 100 patients in 2 hours, 3 hours. How much can the, human capabilities be stretched? Instead, all these parameters, one simple tool is available to the patient in future. They gather all the information, transmit it to the doctor's office. Before the patient arrives, the doctor has all the information about you, and probably the interaction takes much lesser time. Or no interaction is necessary, telemedicine. The doctor is able to communicate, okay, I've seen your parameters, this is what you're having, this is the problem, and this is the solution. So you have to update yourself with what are the recent advances or the research which is going on technologically, this engineering, biomedical and medical advances, how all these fields are coming together for the future, what are the potential opportunities which are available, and you have to look for career opportunities. You may be path breakers, you may be actually inventing some path, some career path, new path. So these are all wonderful opportunities which I thought I should share with you.